that shout out. So I'm Ed Hurwitz. I am I'm a pediatric rehab doc at the University of Michigan, Michigan Medicine, Department of PM&R. And I just want to spend a few minutes talking about improving capacity and assessment for adults with cerebral palsy. And here's the statement of the problem. Adults with cerebral palsy have unique health challenges and wellness challenges. We've just heard a lot about some of them from Mark and from Dan. There's too few physicians, especially specialists, who understand their care needs and their risk for all these chronic diseases we have been talking about. So what we want to do is improve assessment of chronic disease risk in the in-person clinic setting in a feasible manner and expand capacity of care through telemedicine. We want to include a reliable assessment of chronic disease risk, both in-person and on virtual visits, and develop protocols for intervention. So I have a study that's been funded from the Foundation of Cerebral Palsy, and it's going to be looking at adding grip strength measures to body composition assessment in individuals with cerebral palsy to accomplish the first of these aims. So what we don't know is the natural history of chronic disease and cerebral palsy, all the things that we've just been talking about, and can we change that risk by doing interventions? We don't know the best tools for screening for chronic disease risk. And we know the studies of body composition are often very complex, like a DEXA. BMI doesn't work very well because the people with cerebral palsy have a low bone mass and low muscle mass. So it doesn't really tell us, looking at our usual numbers of BMI, how that works. And other factors play a role. Those other factors include strength. So we want to think about grip strength because it's an established biomarker of health. It's not well tested in cerebral palsy. It's highly correlated with other measures of strength. And in typical developing people, weak grip is associated with all the problems that you see here. And there's been some studies in children and adolescents which showed an association with cardiometabolic health. So what we want to do with our study is test the clinical feasibility and reliability of body composition, waist-hip ratio, skin folds, and then strength measures like hand grip performed in a clinic setting on individuals with cerebral palsy. We want to correlate that with the medical history, and our long-term goal will be to have a set of measures that can assess risk and the effect of intervention on risk, intervention for children and for adults. In terms of a vision for care for adults with cerebral palsy, we want to determine the best practice for clinical practices, including surveillance for health risks, pathways for treatment and interventions, and patient-centered care with lifestyle interventions. We want to expand care using technology for greater reach. And we want to be able to measure risk via telemedicine and educate and build knowledge and interest in this area. So we want to expand our capacity for reaching out to adults with cerebral palsy. So I'm working with the Cerebral Palsy Research Network and their MyCP webpage group as a source of people needing care. And the MyCP group is going to be referring people in for telemedicine visits. So I'll be working with people around the state of Michigan and then working with their local resources to expand our assessment capacity. So can we assess for chronic risk for wellness? Well, we can take a history. And then working with some measures that are being tested by Dr. Larkin Mara, a PhD student at Michigan Medicine, University of Michigan, includes some tests like the timed up and go, the chair stand, tandem stance, Romberg, lift and carry, things that we can assess through telemedicine. So we're going to be testing the feasibility of doing those and how effective it is for doing those kinds of things. Hopefully to be able to give us more information about how we can assess people through telemedicine. Here's Duncan. He came to speak to us once. And he told us we have to spread the word. We have to reach out to primary care, to physicians, PAs, NPs. We have to tell them information is power. We have to teach them how to teach their patients and how to help people with cerebral palsy stay functional well. So here we are, and that's our main goal. That was a little bit of a quick presentation, but I just wanted to give you an idea of some of the things that we're doing along in those areas.